Well, President Barack Obama is back from his trip to Europe and Africa, and his top priority this week is expected to be health care. The reform effort remains bogged down on Capitol Hill, with cost the main point of contention. Let's take a look at where things stand right now. On the Senate side, the Finance Committee has not yet released a draft reform plan, but has started looking at ways to pay for the overhaul. The latest idea is subjecting capital gains income to the 1.45% Medicare tax. That could raise hundreds of billions of dollars over the next 10 years. Now, this comes after Senate Democrats backed away from a tax on employer-provided health benefits. And on the House side, the Ways and Means Committee is proposing a surtax on households earning $250,000 or more. Estimates are a surtax would affect 2.4% of U.S. taxpayers and raise $375 billion over 10 years. Well, Bloomberg's Kristen Jensen is covering the wrangling in Washington over health care, and she joins me now from our D.C. newsroom. And Kristen, what is going to be today's big news on this front?
Well, the big news today is really going to be in the House. As you mentioned, Betty, we are going to see the latest draft of their bill, and we've been told that there will be a surtax on wealthy Americans. Now, that's obviously something that is very interesting to a lot of people. They want to see how that tax is going to shake out. And the Senate really hasn't landed there yet. It is one of the options they're considering, certainly, especially on the higher income Americans starting at $350,000. But they haven't settled that yet. So it's going to be interesting to see how that all shakes out.
Well, Kristen, detail us the main sticking points in general for the House bill.
Well, the main sticking points, the House bill has gone through essentially pushed by the Democrats at this point. So you have some of the conservative Democrats and the Republicans who are crying bloody murder, saying they haven't been involved enough, and also really concerned about the method of taxing. A lot of those lawmakers would like to see the taxes come from within the healthcare system. So you're seeing cost as a stumbling block there. Also, the House has embraced the public option. Now, while the House Democrats can kind of push through anything they want, eventually they're going to have to reconcile this bill with the Senate, and so that's going to be an issue in the Senate.
And Kristen, the president has so far stayed out of the health care debate. Can we expect him to start taking a more active role in the negotiations?
Yeah, he's really tried to do exactly the opposite of what the Clintons did. And, you know, we've talked to all the people who went through the Clinton thing, and they said that's what he should do. But a lot of senators right now are saying he needs to take a more active role, and we are expecting him to do that in the coming days.
Okay, Kristen, thanks so much, and see you in a little bit. Kristen Jensen on the health care reform debate going on in Washington.